Bankmed, a journey through 110 years of our legacy, your health. The beginning of Bankmed's journey came from a culmination of collaboration, initially amongst 5 bank employees who pulled their resources together from around 1910. This evolved to the creation of what became United Bank's Medical Aid Society. Mr. William George Buss was credited as the founder of the society on 15 July 1914. By the time the society was formed, there were about 77 members. Little did those first 5 bank employees know what a success their collaboration would grow into and what a legacy it would create. Already at the forefront of innovation in the industry from early on, we were ahead of our time in appreciating gender equality, and in 1920, we were the first society to allow women to join. Thanks to our innovation and forward thinking, our membership soon tripled due to the amalgamation with the Natal Medical Aid Society. By the 1930s, around the time when claims exceeded contributions for the first time, our growth and profile saw us playing an integral part in the formation of the Representative Council of Medical Aids in South Africa and the formulation of countrywide tariffs. In those years, Mr. A.M. Fulmer became the first permanent general secretary of the society. Given our close association with the banks, it is not surprising that we were then the first organization in South Africa to print barcodes on checks, further testament to embracing and demonstrating innovation. Between 1950 and 1970, membership of our blossoming society had grown to around 20,000. One of those members, Denise Dovell, was the heart donor for the first successful heart transplant carried out by Dr. Chris Barnard in 1967. The appointment of Mr. Johan de Klerk as principal officer and general manager ushered in a period of significant change and growth during the 1980s. One of the first changes motivated by de Klerk was the change of name from United Bank's Medical Aid Society to simply Bankmed. During these tumultuous years, Bankmed remained a constant in the industry and was among the first medical schemes to appoint a permanent medical advisor, Dr. Norman Levy. Our major clients at this stage were Barclays National Bank, now FNB, Standard Bank, Volkskas, now Absa, and the SA Reserve Bank. Our client base has since grown to include even more. The formation of Absa in 1991 led to the addition of Trust Bank staff as members of Bankmed. De Klerk was furthermore instrumental in Bankmed amalgamating with several schemes, including United Building Society Medical Aid Scheme and Allied Building Society Medical Aid Scheme. The 1990s saw our membership grow to more than 80,000 members, and along with that, the administration capability of Bankmed was significantly enhanced. During this time, we enjoyed much praise and accolades from the industry, leading to a Professional Market Research Award. Under the leadership of de Klerk, Bankmed also started administering other medical schemes. This change in the business model would have profound positive implications for us in the future. In the period between 1988 to 1996, under the stewardship of Mr. Colin Hunt, Head of Human Resources at FNB, and Mr. John Furster, Head of Human Resources at Standard Bank, Bankmed continued to grow both as a medical scheme and as an administrator of medical schemes. Hunt and Furster were Chairman and Vice Chairman of the Board of Trustees respectively for a number of years. In 1997, it was resolved to realize the value that had been created in the administration division, which by that time had grown to the extent where 13 other schemes were being administered by Bankmed. Due to this growth in the division, the administration business was put out to tender. The successful bidder was Metropolitan Life, then the parent company of what is today the Metropolitan Health Group. The sale of the administration business resulted in Bankmed outsourcing the administration of the scheme to MHG from 1998. The proceeds of the sale resulted in a significant increase in the reserves of Bankmed, which has stood the members in good stead ever since. The change to outsourcing of the administration now enabled Bankmed to focus primarily on the business of a medical scheme and continue to enhance the value that it had created with its employer group clients as partners in health and wellness. The new millennium would bring more growth and change, and in 2000, Professor Letitia van Dijk was elected as the first woman chairperson of the Bankmed Board of Trustees. At this time, Bankmed entered into a strategic partnership with Merit Healthcare Services. This partnership heralded a full commitment to the principles of Merit Healthcare, a vital element of which was wellness. This strong focus on wellness is one of the driving principles of Bankmed to this day. It was also in 2000 that Bankmed decided to voluntarily participate in the credit rating assessment by an entity operating as the Global Credit Rating Company. The very first rating accorded to Bankmed was a strong AA negative. This was upgraded to AA in June 2006 and upgraded again to AA positive in May 2011. Bankmed continues to enjoy the AA positive rating, which is associated with very strong financial security characteristics. What a formidable scheme! From around 2008, Bankmed also started to participate in the quality assessment exercise that is carried out annually by an entity operating as Health Quality Assessment. This industry-wide exercise enables the assessment of the clinical quality in healthcare offered by medical schemes. One useful definition of quality of care explains this as the degree to which health services for individuals and populations increase the likelihood of the desired health outcome. The quality of Bankmed's healthcare offering has been consistently better than the industry average, and Bankmed has been coming out as a leading medical scheme in this regard. In 2014, Bankmed commissioned an analysis of the value offered by the scheme. This was carried out independently by the scheme's actuaries and consultants, who were operating as Towers Watson at the time, and now under NMG consultants and actuaries. The outcome of the analysis suggested that Bankmed members, through a combination of richer benefits and lower contributions, enjoy better value by as much as 32% on average compared to what they would enjoy with an average open medical scheme. This is the better value that sets Bankmed apart and has increased to 38% by the beginning of 2024. This translated into an average of 35% better value for members between 2014 and 2024. Continuing its growth and following a very thorough and exemplary tender process, Bankmed appointed Discovery Health Pty Ltd as its new administrator with effect from 1 January 2016. Always focused on improvement, the scheme engaged Alexander Forbes, another reputable entity in the industry, in 2023 to carry out a peer review on the initial analysis that was carried out by NMG, and also do its own review of Bankmed's better value assertion. On the peer review, Alex Forbes concluded that overall the calculations and methodology applied when calculating these measures were deemed appropriate, and that the 2023 relative value figures shown by NMG actuaries were deemed a reasonable reflection of the value of Bankmed's benefit offering. Alex Forbes' own benefit richness comparison analysis, in which they calculated the benefit richness of each of Bankmed's options and comparable options in the open market, led them to conclude that each of Bankmed's options offer relatively higher richness compared to options charging similar contribution rates, or relatively lower contributions compared to options offering similar benefit richness. Bankmed's products were found to be even more valuable for lower income groups who are able to enjoy rich benefits for relatively low contributions. In the course of 2023, even more confident than ever before, Bankmed went public about its better value assertion. Bankmed, originally created by bankers for bankers, has always been acutely aware of the developments and evolution in the banking industry over the years, including banks having to also register as financial service providers. Bankmed's appreciation of these developments informed the scheme's current and latest vision: to be the medical scheme of choice for the financial services industry. Our last challenge in this regard was to secure approval from the Council for Medical Schemes, or CMS, the regulator, to approve the expansion of Bankmed's membership scope into the financial services industry. After a lot of effort, over many years, approval was eventually secured in September 2023. This was a huge milestone for Bankmed and its current and future partners in health and wellness. It enable the realization of Bankmed's aspiration to expand partnerships in health and wellness in the best interest of the scheme and its members. As at the end of 2023, Bankmed takes care of 107,573 principal members, translating to 221,270 beneficiaries. The 2022 annual CMS report, out of a total of now 71 medical schemes, places Bankmed as the 7th largest medical scheme and the 3rd largest restricted medical scheme based on principal members, but the 8th largest medical scheme and the 4th largest restricted medical scheme based on beneficiaries. Bankmed's continued existence is attributable to the employer group's care for their employees, the need for collaboration, and the need to optimize risk pooling to create and nurture a sustainable healthcare solution. The scheme has been thriving progressively since 1914, and its business model has created tested better value that sets it apart. Bankmed is led by bankers and trustees who, standing on the shoulders of giants who came before them, have mastered the art of nurturing better value while protecting the sustainability of the scheme. The current chairman and vice chairman of the board, respectively, are Mr. Jeff Cresswell and Mr. Doug Bolt. The scheme office team, currently made up of a total staff complement of 17 committed employees, is led by Mr. Teddy Mosomotani. He joined the scheme on 1st of May 2008, became the chief executive and principal officer with effect from 1 July 2013, and is ably supported by a strong executive and senior management team. Bankmed is a leading, formidable, 110-year-strong scheme in good health for your good health. The scheme is also proactive and responsive to how the healthcare landscape may change and participates in industry deliberations with a view to influencing the changes in the best interest of its members. Bankmed's better value and legacy are unparalleled, and this is now available for the broader financial services sector. Celebrating 110 years of legacy, Bankmed, yours in good health.